During this training video, we will learn how to replace the Compat Buddy gastrostomy button. The Compat Buddy button is available in a convenient kit on medical prescription. Replacement may be carried out by a healthcare professional or by the patient or a carer after proper training. It is important to communicate all information about the device to allow better prevention and management of complications. The Compat Buddy kit contains a gastrostomy button, a stylet to facilitate button insertion, water-soluble lubricant to facilitate insertion into the stoma opening, gauze for cleaning, a lure syringe to inflate the balloon, 2 straight and right-angled 30 cm end-fit extension sets, 1 end-fit syringe compatible with the extension sets. The Compat Buddy button is available in a wide variety of French sizes and lengths to meet the needs of patients throughout their journey. The French size and length are shown on the medical prescription and on the cap of the button. If in doubt about the size of the button, contact your physician or healthcare provider. Before beginning, please read the button instructions for use and refer to your institution's or physician's procedures. Prepare all necessary equipment on a clean work surface. Check the French size and length of the button according to the medical prescription, as well as the expiry date shown on the packaging. Wash your hands with soap and water or with a hydroalcoholic solution. Remove the kit from its packaging and open it. Begin by checking the functional integrity of the equipment, especially the balloon integrity. To do this, inflate the balloon using the lure syringe containing the volume of water shown on the inflation valve of the button. Visually inspect the balloon, then deflate it completely using the syringe. Insert the stylet into the feeding port of the new button. The stylet makes the button more rigid so as to ease insertion. Place some lubricant on a gauze and lubricate the shaft of the button, then place the button back in its packaging. Before removing the button in place, clean the skin around the stoma with gauze soaked in antiseptic. Rotate the button to check that it does not stick. Then connect the empty lure syringe to the inflation valve of the button and aspirate the water to empty the balloon. Be sure to aspirate all the remaining water from the balloon. Carefully remove the button from the stoma. Clean the skin around the stoma again and keep, if needed, some gauze in place in front of the opening to prevent leakage of gastric fluid. Then insert the new button into the opening of the stoma without forcing until the external retention system of the button reaches the skin. If you feel resistance, place some lubricant directly on the opening and insert the button by gently turning it clockwise. Fill the syringe with the volume of water indicated on the balloon valve or with the volume prescribed by the physician. Inflate the balloon, taking care to push the button down to the bottom with your index finger so that the balloon inflates in the stomach. Inflation should be painless. In case of pain, fully deflate the balloon and start over, pressing down more firmly with the index finger on the top of the button so that the balloon inflates in the stomach and not in the gastrostomy tract. Disconnect the syringe while turning it gently to prevent the water from flowing back. Once the balloon is inflated, tug the button gently to confirm its placement. Make sure that it turns freely by doing a complete turn clockwise. Remove the stylet and close the cap of the button. To finish, clean the skin around the stoma with gauze. Before using the button, verify it is positioned correctly in the stomach. This is done by flushing it out with the appropriate volume of water. A confirmation by aspirating a few millimeters of gastric fluid can also be carried out by connecting an end-fit syringe to the extension set. If in doubt, contact your physician, who will decide whether an additional radiological verification is necessary. Once the correct position is confirmed, remove the extension set. Check that there is no oozing around the stoma and clean the skin. If needed, place a split gauze pad over the button. The Compat Buddy button is now ready for use. Inform your healthcare provider of the button replacement or note the information in your patient file.